Welcome to this very special edition of the KJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their insights, information, or simply learning from them. And today we have Erin Galyean. She is a published author, professional speaker, a published author of Badass Advocate, Becoming the Champion Your Loved One Deserves. Welcome to the show, Erin.
Thank you so much. Thanks for having me.
You are welcome. Welcome to the show. Welcome to India in this online form, Erin. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now, learn from you about how one can navigate healthcare like a pro, how they can stand for, empowering families to advocate for their sick loved ones. We learn all that from you. Before that, let's learn a bit more about your background, your journey, so that people know who they are listening to.
Absolutely. So my story starts in 1997, a long time ago. My father was diagnosed with non-Hodgkin's lymphoma. I was just 19 years old when he received this diagnosis. I was away at college, and I'm here in the United States. So I was several states away from my parents. And the diagnosis at first was positive, and then unfortunately it took a negative turn. And my dad was this big personality. He was so much fun and loving father. So we were very blessed. And unfortunately, 10 months later, he passed away after his diagnosis. Fast forward 20 years, and my sister Megan was diagnosed with the same cancer, non-Hodgkin's lymphoma. Her situation was different. It supposedly is coincidental that they had the same cancer, but her cancer was a different strand. So it was supposed to be a curable non-Hodgkin's lymphoma, which it ended up being that she did go through chemo and was cured, didn't have cancer, was in remission. But when she found out she had the cancer caused an autoimmune disease. And then the autoimmune disease caused a very rare and aggressive lung disease. And this was the bad news. So in a weird way, the cancer was the good news in her diagnosis, and the lung disease was the bad news. So through this 13-month period of her battling this awful lung disease, I live in Dallas, Texas, and my sister and her family, and also my mom and my brother lived in Charleston, South Carolina. So quite a ways away, half the country. And I would fly back and forth to support my sister and my family when I could. I had a young child at the time. And as background, I've been in the pharmaceutical industry for over 20 years. So I used to be a pharmaceutical rep, which for anyone who's not familiar with what pharmaceutical reps do, you basically make sales calls to physicians. And all day long, you speak to doctors, nurses, you learn how to ask them good questions about their treatment options, how they handle patients, depending on what the disease is that you're talking about. And that's my background. I had done that for 10 years. And then the last part of my career, most recent, I have been a trainer. So I teach reps how to sell to physicians and how to ask good questions and how to handle personalities that are different than yours and how to navigate the office. So when my sister was diagnosed with this awful lung disease and I was going back and forth and supporting her, I realized that my background of being in the pharmaceutical industry was really advantageous because I knew how to ask good questions to get the answers that we needed for Megan. I knew how to navigate some of the difficult and uncomfortable situations that come with a serious illness. Unfortunately, I kind of mentioned earlier, my sister only lasted for 13 months. So she passed away a few days before her 48th birthday. So just like my dad, she was very young. My father passed at the age of 53. So we were devastated. My sister, just like my dad, was loving, kind soul. She also had a young family. And after she passed away, I was heartbroken. She was my best friend since the day I was born. So this was a hard time. And I went into a dark space. But I realized, I had a family of my own. I had to come out of this darkness. And the only way I could think of to do that was to help other families in honor of both my father and my sister, and share what my family had learned along the way, as well as all of the things that I've learned in my career that I was teaching reps how to do, that I was using in this different space, right? As a patient advocate, a family caregiver, versus being the pharmaceutical rep. A lot of the things transferred. So that's why I wrote the book, Badass Advocate. And the goal is to basically help families learn how to navigate this uncomfortable, painful situation of caring for a sick loved one.
Absolutely, absolutely, Erin. And that is where you see you had knowledge of the pharmaceutical industry. More than almost 99.99% will not be from related to pharmaceutical industry at all.
Right.
And that is where I will look at it mostly from that angle. You will be able to guide, especially people who are expert in their field but don't know anything about pharmaceutical. Forget pharmaceuticals, they don't even know about their body. They don't even know. They have heard about the parts, they don't know what those parts do, different organs of the body do. Only when something happens, then you start finding it out. So from
That's right.
a particular person's point of view, person living in a rural place, educated person, non-educated person, person with means, no means, if someone comes to know about something that is that looks to be uh, you can say terminal, non-terminal, very difficult thing, what
Mm-hmm.
should they do? The first reaction most of the time is the person will be in a bit of panic. They don't like this news.
Right.
What do you suggest from that point of view? Help us understand from either in terms of the mental mindset, what how should people look at it? What are the questions that there are so many things at that point in time,
So
you
many.
know it better.
So many. It's overwhelming, actually. How do you get started? And what do you do when your loved one first gets a diagnosis? And I'm so glad you said terminal and not terminal, because I think a lot of people think my book is only for patients and family members that are dealing with a terminal illness. That is not true at all. The tips I'll share today and in the book are for anyone. It can be a short-term illness. Some of these things you can learn, you can use even if you're just going to the doctor's office for your well checkup. So, and then some things, obviously we can talk about for terminal patients. But one of the first things you want to do is sit down with the patient. Being upfront and honest with each other is the best way to handle this. It's very uncomfortable for many of us to talk about illness and health, especially if it's terminal, but you need to be straightforward and honest and open, not just with your loved one, but also with the physicians. The more you can do that, the better of an advocate that you can be, because you know where you stand. You know what to do next. So I just have that mindset of just addressing things head on is probably the best, even if it's uncomfortable for you. You're the advocate. You're going to step out of your comfort zone to do what's best for your loved one who's dealing with an illness. I also would recommend getting a notebook. It doesn't have to be fancy. It can just be paper and a pen, just something that is easy for you to reference. Also, if you have a cell phone, use that. I think most of us have cell phones these days. Use the app in there that's called Notes, or whatever you have that you want to reference, because you always have your phone with you. Always bring your notebook. This is to keep track of everything from day one forward. It seems very elementary to someone who's been a caregiver for a long time, but for someone who's never been in this situation, that is like the foundation of just keeping track of everything. So you want to keep track of what appointments you're having, the patient's having, what medication they're on, what conversations you're having, what questions you've asked and the answers you've gotten, and then also what questions you haven't asked yet. So I'll talk about questions in a minute, but so make sure that's kind of like your base. From there, when you meet with the patient, it's really important that you talk about a support team. There should not, if you can, have more than one person that is helping with the patient. There typically is going to be one person that is the main caregiver. They do the day-to-day care for someone that is seriously ill. But other people, you need to kind of let other people in to support. So with my family, we were lucky. We're a tight-knit family. And so, even though I live far away, I found ways that I could support my mom and my brother because my mom was the main caregiver. And then, of course, support my sister and her husband and their family. There's so many things you can do to support people. So we kind of gave ourselves roles. And I talk about roles a lot in the book because I feel like it's best if we give people certain things to take care of, then they know what they're doing. A lot of times people want to help someone who's sick or the family that's dealing with an illness, but they just don't know what to do. Where do I step in? I don't want to overstep. I don't want to pretend it's not happening, but I don't want to also be too nosy. So the more that if you are the spouse or the sibling or the parent or even the adult child that's taking care of a parent, if you're that main caregiver, it is kind of your job to organize everyone and say, look, this is what we are doing. I need your help with this. And it can be something as easy as taking out the trash from a neighbor that lives next door, that's just one less thing on your shoulders, to someone coming in and doing something more heavy lifting work, which is, I need to go to the grocery store. Can you come into the house and just sit with my loved one and make sure that they're okay? They're not going to fall. If they need to go to the bathroom, you can help them get there, whatever it is. If you need to make them some food, here's how you do it. Here's what's available. There's so many ways that we can support people who are sick and their main caregiver, because that main caregiver also needs a lot of love and care. A lot is on their shoulders because life doesn't stop when you have a sick loved one. Bills need to be paid. If they're working, they still need to go to work. None of that stops just because someone has an illness, unfortunately, but it's just extra on top of their shoulders. So that's where I get started. Get a notebook, use your phone to keep track of things, and then create your support team. Figure out who do we want to come in? Who is the patient comfortable with? That's another thing to talk about with the patient. You don't want someone coming in that they're not comfortable around, because they will see them in compromised situations. And who are they okay with being around and seeing them in that way? They're not going to be in their best light, if that makes sense.
Absolutely, Erin. In terms of getting the best from the healthcare system, the first is that you come to know about the illness from a doctor or from establishment, the way it is. How do we know that what they are saying is 100% correct?
Yes,
should we question it? Should we not question it? Should we just accept it?
Absolutely. Great question. So a couple of things. Number one, you need to go in prepared with questions. So now you have your support team, right? So you've got the patient, the main caregiver, and a couple of friends or close family members that are part of this core team. Not the ones that are taking out the trash necessarily and doing some of the small things. Of course, anyone can help with that. But if you have a few people that are kind of involved in the day-to-day care, or they come over during the week to support, those people you want involved in this next exercise that I'm going to prepare you for. Before any doctor's appointment, or if the patient's in a hospital, this can be done over text message. That's how my family did it. However you want to handle it is great. Come together and come up with a list of questions. So for my sister, it was my brother, my mom, her husband, and my sister. Include the patient always. It's their care. Don't forget, they need to be involved as well. There are sometimes patients won't be involved, like if they have Alzheimer's and they're not all there, they might not be involved in this aspect. But if they can be, make sure they're involved. So we would come together and we would come up with a list of questions for the healthcare provider, whether my sister was in the hospital or if she had an oncology appointment that was 2 weeks away. The same system worked. We would text each other, and I created in the Notes app in my phone, and I don't know how Android works. I assume it's similar, but I could share the Notes app. And so we would share it, and then we'd write down all of our questions. So I might have a question like, what is this medication for? Or what is the risk of her doing this exercise? Okay, so these are some questions. And if I come up with that question, it may spark an idea in my brother. He may read that question and think, oh, that's, you know what? I have a question related to that. And then my mom may read it and have a question that's completely unrelated. And so now all of a sudden we have 20 questions. So we compile those. And then before the appointment or before we're meeting the doctor when they come into the hospital, go through those questions and organize them. Are there any questions that are redundant? We're kind of asking the same thing here, so I'm going to eliminate that. Okay. So now those 20 questions are, let's say, 18. Now those 18 questions I'm going to review again. And I'm going to look at them and say, okay, there are two types of questions, and this is a sales technique. There are open-ended questions and closed-ended questions. Open-ended questions are questions that start with who, what, when, where, and why. So what they do is they naturally cause the person that's answering the question to give you more information. Instead of saying something that's starting a question with a close-ended. So a close-ended question would be is, do, are, and can. I'll give you an example. Instead of saying, can my sister go for a walk? That's a close-ended question. You could transport to an open-ended question and say, what kind of exercise can she do? So with the first one, the close-ended, can she go for a walk? I'm really narrowing down that question. I'm only talking about walking. There may be other options that I haven't thought about. So if I ask the physician, what kind of exercise can she do? That really opens up the door. Now the physician can say, oh, you know what? She can go for a short walk around the block. She can do the bike. It's just, the bicycle, the indoor bike. No lifting weights. I mean, they may have some stipulations. So now I'm getting better information versus the close-ended question. So now I'm going back to my list of 18 questions and I'm seeing, okay, I have 5 or 6 of them are close-ended questions. Can I change them to be open-ended questions? Yes. Okay. Let me figure out how can I make these wider, better questions. Now there may be a few in there that you can't do that because you need to ask a closed-ended question because you're clarifying something that the physician told you before, and that's okay. Keep it as is. It's just the ones that you naturally made them closed-ended that are better open, change those to get better information. And then the last step is go through those now 18 questions, and are there any of those that the nurse can answer or any of the staff members? Physician's time is limited with the patient. Is there a way that we can get some of these questions out of the way so when the physician comes into the room, I have only 8 questions instead of 18? I've gotten, maybe I needed a refill for the patient on the prescription. Do I need to ask the physician for that, or can the nurse help me with that? So there are some things that the nurses, they are a wealth of knowledge they can help you with, and you can spend the best time with them and utilize them to the best of your knowledge. So that's one way of approaching it. And then you asked about, do we believe them, the physicians?
Yeah,
So
believe in the sense that is there something more that is available anywhere else, but we don't know about until and unless we ask?
Yeah, so 2 things. One, always get a second opinion. Always. When you have a serious diagnosis, you should always go get a second opinion. And I don't know how that works in India. Here in the US, you are allowed to go get a second opinion. And here's why I would say to do that is because every doctor has different experiences. It's not a lack of trust. A good physician will encourage you to go get a second opinion because they know if they're confident in their diagnosis and what they're telling you, then the next physician will say the same thing, will give or something similar, right? So definitely get a second opinion if that's possible. And then number 2, there are, on the internet, it's very overwhelming. So I have a website, badassadvocate.com, and I have listed some reliable websites on there. And there's one section that talks about medical websites. These are reliable websites here in the US that I have learned about through my work. I've had pharmacists and doctors that have used these with my company, and They're reliable. They'll give you good information. You just want to be careful that, when we Google something and we look something up and we're self-diagnosing, you don't want to go too far down that rabbit hole, because you also aren't a physician. So you don't want to cause yourself unnecessary anxiety and stress, because it may not be what you think it is. There are so many diseases that have similar symptoms and side effects that you can definitely misdiagnose yourself. So you have to give the physician a certain level of trust, but getting your second and third opinion should do that for you.
Absolutely, absolutely. And before coming to the next question, in India, if you ask me, the healthcare system is very flexible, either on a government hospital or private. You can take first opinion, second opinion, third opinion, fourth opinion, as long
That's
as you are
great.
satisfied. And we
So
very
glad.
right, you are, and in fact, if you are going to the government hospital, in some of the government hospitals, you have got the best doctors. There is no it feels very different to look at the international healthcare system in some of the very advanced countries, that people have to wait for so many years. Even in India, there might be a bit of delay, but if you can afford a little bit of money, in some cases it is difficult, but the difference is very huge. Means when I see people fighting for an x-ray or something, here you just can walk into any hospital, and in $10 or $5 or even $10, $20, you can get your x-ray done. Only the bigger ones will need a bit of more amount, but not more than $100, I would say.
Yeah,
But
that's
you don't have
great.
to wait. You can just walk in and come
That's
out with
great.
your x-ray.
That's great. And I love that you have that ability, because we all should, really. As humans, we should
Yes,
be able to get a second and third opinion, because, like I said, there are physicians that have different experiences. So, just
absolutely.
as an example, my sister, I told you, had this very rare lung disease. So, she had a pulmonologist who she went to, and who was renowned in, I mean, he did more like studies, right? And so he is this big time pulmonologist, but he really didn't see a lot of patients. He did take my sister as a patient. Unfortunately, even though he has all this knowledge, he really wasn't giving her the attention that she needed and deserved as a patient, as a young woman who is severely ill, who needed that constant, like, okay, what do we do next? Now I'm cancer free. Now what? How do we change? And she wasn't getting that. So we decided to switch physicians. It didn't matter that he is this renowned pulmonologist who does great when it comes to research and studies, right? That is fantastic, but we need someone who is going to show up to the hospital and give her the care and attention that she needed at that time. So we had to make that decision as a family and support her and say, we need to look into something else. So just don't be afraid to do that. Do what's best for you if you're the patient, or for your loved one if you're the caregiver.
Absolutely, absolutely. And one more aspect is that with technology,
Yes.
Erin, and that is happening in India also, is that the whole technology is helping in terms of video consultation with doctors.
Yes. Telehealth.
Now you can, yes. So if someone is getting treated even from a government hospital here, you call as a public hospital, and you still want to take opinions, nobody stops you there. Here, you can go to any doctor, any hospital, other hospital, any expert that you know of, talk to them. They will take their fees. If you can't go, video consultation is also available in other hospitals also. Say if I want to consult some physician in my Mumbai hospital, I can do that. So I think it is both ways. Even Indian patients can take help from outside. Even outside patients can also take from some of the good physicians that we have. Our healthcare system also has its own challenges, but those challenges are different. But in
Yeah.
terms of this opinion, taking opinion or expertise of different doctors in different cases, that is very readily available. Here, that bureaucracy is not there, and neither any challenges are there. But yes, practical problem. We have a huge population. We have got many number of people. All that needs a different sort of a thing. Now coming to in terms of expectation for a caregiver, when they are looking at these things, naturally everyone wants their loved ones to be back home soon in very full health and hearty. How and that can also be people with a lot of optimism.
Mhm.
How do they but set their expectations so that it does not harm them, or they feel that God is not listening to them, or it is something unfortunate that is not working their way, because every bit of news in unfortunate cases may lead to a lot of different mixed feelings within the caregiver. How should one set their expectations right as a caregiver when dealing with a loved one?
Yeah, so I have a couple of thoughts on this. I had advice that was given to me by my cousin's wife. He had been dealing with cancer as well. He is fine, but when he was going through it, they used this mindset of try not to get too high on the highs and try not to get too low on the lows. I found that to be challenging, but it was great advice because I wanted to celebrate. When my sister was cancer free, we did celebrate, but she was still dealing with the lung disease.
Yes.
So yes, say, oh, this is a great win. We're so thrilled, but don't get too high on those highs because healthcare, when someone has a healthcare issue, it is like a roller coaster. And there'll be good days and bad days. And if you have that knowledge and that mindset that's going to happen, then maybe your lows won't be as low and your highs won't be as high, and you can maintain like a level mindset. The other thing that I want to share with you, and that I learned this really from my personal experience of my father passing away. I mentioned I was young when he passed, and I didn't ask any of the physicians about where he was. I was too young. I didn't think that I even had the right to ask. So with my sister, when she was diagnosed, I made sure that I had some difficult conversations with her physicians. There was a palliative care physician. So palliative care is basically not end of life care, but they take care of the comfort of the patient, pain management, psychological comfort. And I really trusted her. In fact, she wrote the foreword for my book. I'm still in touch with this wonderful human being. And I went to her because I trusted her. And I said, I need you to tell me straight, what is the likelihood of my sister surviving this? And she was honest. And I'm sure giving me that information, that bad news, was probably not comfortable for her, but she did it because she always does the right thing, as a physician. I also asked, before I asked her, actually, I asked another physician, the hospitalist who was taking care of my sister for a while. I asked him. And again, this is a young physician. I'm sure this is not the conversation he wants to be having about a young patient of his. But I asked, and he gave me the true answer, which is the same as hers. And that's when I asked two physicians, and they gave me the same response was, we don't really know exactly, but she probably will last a few months. It could be a few weeks. The reason why I asked that question is because I needed to know what I needed to do between that day when I asked and moving forward. As I mentioned, I lived halfway across the US. So I needed to know how often and how quickly I need to get on an airplane. I need to know how long I should stay. If she was hospitalized, should I just continue to stay because this could be the end? I needed to know what kind of conversations I needed to have with my sister. As I mentioned, she had two young girls at the time. I wanted to support them and have conversations that were very difficult to have with my sister, but about leaving things for them because they weren't going to have their mom when they were a teenager or getting married and having babies of their own. So being a child myself that lost a parent, I could kind of foresee that these things were going to be difficult for them in the future and sad and just hard times. But if I could give them the gift of having these conversations with my sister while she was alive and leaving some things for them, which we did, then maybe that will bring them some peace in the future. So the reason why I share that very intimate information is because having these conversations with the physicians is very difficult. And the nurses too, by the way. Like I said, always go to those nurses. Those nurses are amazing and they're so knowledgeable. So do not ignore the nurses. They know a lot. But having these raw, uncomfortable conversations with the healthcare providers gives you the power to know what you need to do next. For example, besides the ones I used, also end of life care, end of life conversations. What about, a will? Does your loved one have a will? Do they need to update it? All of these things are critical if they are terminal. If they're not terminal, then maybe the conversations are different. How do we help them survive? When you're a cancer patient and you go into remission, you're still dealing with cancer, just not, you're still with the remnants of cancer, I should say. So there are things that you need to deal with moving forward. Checkups, making sure that the cancer doesn't come back. So those are different kinds of conversations. But the more honest conversations you can have with those physicians, the better off you will be. I know it's difficult. Just step out of your comfort zone. I promise you, it'll benefit you and your family in the end.
Right, Erin. When you are dealing with a loved one, dealing with a difficult illness, you want to ensure that you are looking at all options available, also in
Yeah.
terms of new research, new things happening, so that you don't regret or just you don't want to try your best. How do you do that at the same time? Or you should not do, you should just ask the doctors if there is anything available. How
Well,
did you look at any of this aspect yourself, especially being from a pharma industry background?
yes. So what we did was, remember I talked about the support team at the start of this conversation. This is where the support team can come in handy. There are some people that have the brain that is not the way my brain works, but they love to do research. They love to figure things out, read studies. My brain doesn't work that way. But tap into someone whose brain does. And then when they start to do that research, which they're enjoying doing and they're good at it, and probably not the main caregiver is going to be the one doing this, they have enough on their shoulders, leverage their knowledge. What did they find? So I'm going to give you an example. We had a family friend told my mom that she read an article about my sister's rare lung disease. And there were several studies that were done by a physician. Now she's a pediatric physician, but she did a lot of work with this rare lung disease. My sister's pulmonologist was not an expert in my sister's lung disease because it was so rare. So what I did, so I got that information. Now remember, I didn't do the day-to-day care because I live far away. So one way that I supported my family, being part of the support team, was I took the time to go reach out to this physician. And I also got a recommendation for another physician in Colorado. So one's in Colorado, one's in Maryland. Completely different states. They're never going to treat my sister. They've never seen her as a patient, but they are experts in this disease. So I emailed them, and I'll just use this, the female physician in Maryland, I'll use her as an example. She gave us great tips for my sister's care. One was she needs a feeding tube. So in the summer of 2018, my sister's she was dropping weight very severely. And the physicians taking care of her did not want to give her a feeding tube because it can open you up to infection. Makes sense, right? As a family, we didn't know any different. We went along with that theory, that thought. And it's not a bad one. But speaking to this physician over email, because I reached out to her and she was responsive, she said this is critical because if your sister has lost so much weight, she can never fight the disease. She needs to gain weight in order to fight it. So I'm giving you this as an example that a physician who I reached out to via email helped support my sister. And my sister started to gain weight. We pushed for a feeding tube, which we weren't before, but that's part of being the voice, the advocate, right? Don't be afraid to have that voice and say, this is what this physician who's an expert in this disease said, and we want her to have a feeding tube. And it was the right decision. And she got a feeding tube and she gained weight. And I think that probably helped to extend her life by several months by a physician who she never met. So just know that people, if you do your research and you can find people, especially if it's a rare disease, do that research, find who has conducted studies. Their names will always be in there. Again, I have a website on my website that you can click right to it and you can look up studies for different diseases. Those physicians will know a lot about those diseases, and they can hopefully, if you can get in touch with them, they can give you some advice.
Right. And one more thing is, a lot of talk nowadays is about alternative medicines. Medicines which are not non-invasive, no side effects, but
Right.
people think it can. And see, the such situations are that the doctor has given their prognosis, diagnosis, whatever it is, and it's not very good. Because if it's good, then you may not want to look at anything else. Then people want to look at every bit of hope that is available on this planet or any other planet. How do you tell yourself about this whole alternative medicine is? How do you do that? How do you outsource that research? If there is something promising, how do you
Yeah.
bring that into the system? Because you are a bit hesitant also to talk to your present doctor, because you just don't know their reaction, and it may not be the most, I don't know, it can be a very difficult thing, but I just want to get your understanding on this, especially if something is available, which does not need any US FDA approval or anything or sort that. How would you like to look at this part with this growing understanding of things that can be helpful for patients in many ways?
Yeah, I think that I'm not an expert in alternative medicine, but what I would say is when you do your research, bring that to your physician. I have asked physicians about other, supplements I've taken, and a lot of times they're fine with it. They will tell me to keep doing it. Obviously, there are certain types of physicians that just that's where they specialize. So if that's the route you want to go, I mean, that's up to the patient and the family. If that's an option. There's so much information I know about it, especially when it comes to not even taking something, but diet. But I'm not an expert in that space. But certainly, I think if you want to pursue that, go do your research, always come prepared and speak to your physician that's helping you, especially like, for example, if it's an oncologist, that's a conversation you want to have with them, I believe, because the more they know about what you're doing, what you're ingesting, the more they can guide you and give you good advice of like, you don't want anything to harm you or the patient. That's the one thing. For example, my sister, when she was sick, she had that autoimmune disease. So there are certain things that she could not eat. So we had to learn that along the way. It's not alternative medicine, but it was another way of treating her with food because we couldn't give her certain things. They would cause more pain in her with her autoimmune disease, if that makes sense.
Absolutely. One last question I want to understand from you, Erin, is uh, uh, about the finances. Yes, not everyone is that well off, and no one
Yeah,
is so much well off to take care of difficult illnesses. Only very few people will have that much amount of insurance, that much amount of
right.
personal money. Or for people who do not have these finances, they cannot just sit and let whatever happen to them. What are the things that they can look out for in terms of organizations, government system, state government system, any other authority that can be there or that is there we do not know about, that we can approach?
For
How do
sure.
we navigate this part, especially when you do not have that much of finance?
Right. So there's a couple of options. So one thing is I do a lot of work with a nonprofit in honor of my sister and my father and the cancer type of cancer they had. Nonprofits are fantastic. The work that they do, the money they raise, yes, there's a good chunk of it that will go to research, which of course you want because we want to prevent those diseases in the future. But also, a lot of times these nonprofits are raising money to support the patient and the families that are going through this, right? So they will have grants and funds that they can share with you. So I would look into that, not only national, global, but even your small nonprofits. A lot of times the people that are involved in these nonprofits are there because they have a loved one who has dealt with this illness or they've dealt with it themselves as a patient. So nonprofits is a great way. Yes, government. I don't know about India, but I know here in the United States, we too have some support that you can apply for some things within the state for caregivers, for example. Some states have that, not all. where you can get some funds for it, for being a caregiver, family caregiver that can't work. And then the other suggestion I have is just crowdfunding. So with my sister had some major medical bills, and what we did was I created a GoFundMe, and we raised some money for her and her family to cover some of the medical bills. That was mostly through family. Again, going back to the support team, number one, if you have a teenager or a young person in your life, what they're usually great at is technology. So leverage them for that. Get them to create a website, a GoFundMe account. Facebook is great for raising funds for nonprofits. It's amazing how people will come together. And those people that are not part of the core support team, but maybe more the outliers that still love the patient, care about them, they want to help in some way, donating $10, $20, $100, whatever they can will help. And a lot of times people want to do that because they're not involved in the day-to-day care. They're not taking the patient to the hospital or to the doctor's appointment, but they're willing to donate some money to help pay for those bills. And so those are the three I would say that are the easiest way. So your crowdfunding, your nonprofits, and then look into government agencies and see if you can get any funds from the government.
Right. And very quickly about your book, Badass Advocate, Becoming the Champion your loved one deserves. What does badass mean? You got to become a very strong person to deal with the system and snatch all that is required for the patient.
That's a great question. So look, when my sister was sick, I didn't feel like a badass. I was heartbroken, scared, had a lot of anxiety about what was going to happen, what was happening to her, fear, all of it. But why I named it Badass Advocate is because I feel like if you have the mindset that you are willing to step out of your comfort zone for the benefit of someone else, someone who you love, that is badass. So you're willing to ask the uncomfortable questions. You're willing to be their voice. You're willing to ask for things that maybe are uncomfortable. I'll give you an example. I just was hospitalized right before Christmas for appendicitis. I'm fine. It was nothing major. I had a quick surgery. But when I was leaving the hospital, I was reminding myself things that I speak about here and that I speak about my book, and how can I be my own advocate? And so one thing I did was make sure I had a voice about what medication I needed when I was leaving the hospital. I had a lot of nausea, and they hadn't written me a prescription for nausea. And I was afraid that once I got home and I wasn't on all of the medication they gave me at the hospital, that my nausea would come flaring up. And I don't know about you, but I think being nauseous is one of the worst things.
I understand.
So I said, well, what about a prescription for that nausea medication you were giving me? And she was like, oh, this is the nurse. She said, oh, okay. You want a prescription for that? I said, yeah. She goes, okay, I'll call the doctor and ask. And I got a prescription for that. So that wasn't their plan. It wasn't that they were against me. They wanted to support me and make sure I felt good at home. But I had a voice. When someone is seriously ill, they don't always have the energy to have that voice. They're exhausted. They're not feeling well. They're tired. They're on drugs. They're medication drugs. They might be a little fuzzy in the brain. So being a badass is really just being able to speak up and get out of that comfort zone. If you're not comfortable, some of us are more comfortable having a voice than others, but there's a lot of us that are uncomfortable around physicians, and they're people too. They got into this industry because they want to help people and make people feel better. And so just keep that in mind, that they are people and they will make mistakes. And you, as the patient's advocate, should pay close attention, because when mistakes are made, hopefully you can catch it. I mean, they're all humans, so we can't expect them to be flawless. And I know we want that for our loved ones, but that's just not realistic. So have that perspective going in that there will be mistakes made. Hopefully they're minor mistakes, but if you can catch them, that can make a real big difference in your patient's recovery, in their care. That happened with our family too. And we were strong enough to speak up and say, something doesn't feel right here. Or I think she might've missed a medication. Don't worry about stepping on someone's toes. Do what's best for your loved one.
Absolutely. So what is the best way one can make use of your book that you have actually written with so much of care?
Yeah. So my book is on Amazon. So that's where you can find it. I have a website, badassadvocate.com. I've got not only the book and I have some journals, but I have a lot of resources that are just free, websites, some free downloads. So take advantage of all that. I created it just to give it away, not for any profit, but just to help other families like mine who are struggling and being challenged by a healthcare issue. So that's the best way to kind of find me. I'm on pretty much all social media, except for Snapchat. I think maybe that's the only one. But I make videos on TikTok. So if anyone's on there, and then Instagram, Facebook, all of that, I'm on all of those. And that's an easy way to find me. And hopefully, when you go through the book, the other thing that I would advise is that at the end of each chapter, I have a summary page. So it's kind of like a check mark. I like to check things off, like my to-do list. Like, yep, I did that. So that's always a good feeling to me. So I kind of made a checklist at the end of each chapter that will help summarize what I talk about. So if you get the book, and you are in the thick of it and you don't have time to sit through and read the whole book, skip to that end of that chapter. It'll give you a summary and hopefully you can start using the tips right away. And then if you need to dive in deeper, you can go back into that chapter and read a little bit more.
Absolutely. With this, it's a wrap on this very special edition of the KJ Masterclass Live. Thank you so much indeed for joining us.